drive-through testing in Surrey today. The testing system only picks up a certain amount of the Omicron variant, and as it's not yet clear how much of a threat it poses, ministers hope to slow its spread with measures not always popular, like pre-departure tests for travellers.
Well, look, we weigh up the balance very carefully. I do think we just need to make sure we take as a precautionary measure the steps necessary to stop any new variants coming into this country seeding and undoing the good work that we've done with getting the virus under control.
The travel industry has already been hard hit by coronavirus, and the new pre-departure tests for anyone coming into the UK have been described by its representatives as a huge blow. What's the problem with asking people to complete what is a relatively inexpensive lateral flow test?
Some people would be reluctant to travel with a pre-departure test in place because if that test were to be positive, they would then be faced with having to self-isolate in the country where they were, as opposed to in the UK.
This is the rise in detected Omicron cases over the last few days, but only a proportion of test results are sent for sequencing, so the true figure will be considerably higher. As the variant appears highly transmissible and already here, scientists in South Africa, where it was identified, say it's too late for travel restrictions.
The knee-jerk reaction from the rest of the world has been totally uncalled for. Why not wait for the science and look at the science? And the number one thing that the science of transmission would tell you is that if there's a very transmissible virus, travel bans is not going to keep that virus out of your country.
But here, the government hopes that travel restrictions will at least slow the spread of the Omicron variant, while scientists work out whether or not it actually is a serious threat to public health. Carl Dinnan, ITV News.